generally asking for help is a hard thing to do. I think definitely, I mean, just kind of speaking to being a Latino man, right? Like there are things that I carry that I know prevent me sometimes from asking for the help that I need. And it's not just with diabetes. I mean, it's just like in life, there's things that come up, and I think, being humbled through the experience of kind of learning that, especially like being a type 1 diabetic, that there are things that I've got to pay attention to, and I can do 100 things right in a day, and my numbers are still going to go high, right? Day to day, it looks a little different.
Welcome to the Reclaim Your Rise podcast. My name is Lauren Bongiorno, nationally board certified health coach and founder and CEO of Risely Health, where we help people and families impacted by type 1 diabetes take ownership over their lives so that they can transform with more freedom and confidence. Everyone has a different reason to be here. You might be seeking knowledge, support, or community, but at your core, I know that you long for something deeper. You're here for transformation. And that's what the Reclaim Your Rise podcast is all about. A quick reminder before we start the show that nothing you hear on the Reclaim Your Rise podcast should be a substitute for personalized professional medical advice. Please always consult your physician or other medical professional before making any changes to your diet, insulin dosages, or healthcare plan. Heads up, everyone, and take out your calendars because I have an exciting announcement to make. Oh, I've been waiting to share this with you. So on Thursday, November 2nd, we are kicking off National Diabetes Awareness Month with, drumroll please, Rising Above T1D, a live virtual event for reclaiming your life with type 1 diabetes. I promise you, I am not just hyping this up. This event is going to be epic, and it's going to bring us all together from all over the world, all stages of diabetes, family, friends, caregivers, healthcare professionals. Spread the word because everyone is welcome, and it is going to be a party, I promise. My in-studio co-host this year is Neil Greathouse, otherwise known on social media as The Beaties, and whom is also a coach on the Risely team. I want you to think of this as 90 minutes of like diabetes reality TV, where for a night, diabetes doesn't have to be clinical and doesn't have to be dry and it doesn't have to be boring, but it's going to be something that combines community and connection and passion and energy and education and celebration and real conversations with an all-star guest panel and plenty of giveaways with a few surprises in store throughout. I see this truly as one of the most important things that the Risely team and myself do all year, because it's a chance for all of us to really come together and remind ourselves and each other that yes, diabetes is a challenge we didn't choose, but it is one that we can rise above. So Rising Above T1D is free to attend, but you need to register. So use the link in the show notes below to save your spot. And I also want to encourage you today to share that link with at least 3 people that you know would want to know about the event. It could be on social media, LinkedIn, through email, through text message, but go ahead, sign up yourself, and then share the love with everyone else. All right, guys, see you there. We have Jesse Hoyt on the show today, everyone. Jesse is 36 years old, lives in Chicago with his wife and dog Otis, is the executive director of One North Side, a company that organizes grassroots leaders in neighborhoods to eliminate injustice in diverse communities, and was diagnosed with type 1 diabetes 11 years ago after first being misdiagnosed as, you guessed it, type 2. I first met Jesse over the summer when I hosted a meetup in Chicago for our coaching alumni that were in the area. And I was so captivated by his love for travel and hiking and being outdoors and backcountry trips that he's taken all over North America, South America, and Europe, and how he's used that as his motivation and anchoring into that being his why for his diabetes transformation that he embarked on this year. And specifically, when I say transformation, you'll hear Jesse talk about it in a bit, but just to give you a preview with some stats, Jesse went from a 7.8 A1C before starting coaching in May to a 7.0 A1C, so a 0.8 drop in 3 months. He went from a 175 average to 145, from a 58% time in range to over 70% consistently. And he's also increased his insulin sensitivity a ton, dropping his total daily amount by 6 units. So we expand on all that in this episode. episode, Jesse also shares about his relationship to asking for help as a Latino and as a male, the story of when and how his wife stepped in to say that she was worried about him and his numbers and wanted him to get support, and that she helped him do that. And just like overall, the adventure side of things, right? The practical things that you have to think about to do a multi-day hike as a T1D. We can do it all, but we do have to have a little bit more preparation. And Jesse is the expert at this. So without further ado, help me welcome my guest today, Jesse, and let's rise. Jesse, thank you so much for being here with me today. Welcome to the show.
Thank you. So excited to be here. So excited to talk with you.
This is a long time coming. We met in Chicago when I hosted a little bit of a Risley meetup for our alumni a couple months ago. And everybody who talked to you came to me separately and was like, you need to have Jesse on the podcast. And now you're finally here. So this is going to be great. How are you feeling about coming on and sharing your story?
It was great meeting you for sure in person, that's so nice to hear that you had people coming up and saying that we should meet because I've been looking forward to this, but I've really enjoyed listening to the previous guests and have really enjoyed the kind of perspective that you and the whole team at Risley bring. And so just excited to be here, share a little bit about myself and hopefully interest some of your listeners in what I've got to say and share.
Oh, I think you have stories that people will be very intrigued by, and just your whole adventurous side that we'll get into. But why don't we kick things off the way we do with every guest, which is asking you to share a story of a time that you felt like you really reclaimed your rise, that rising above your challenges, rising above diabetes, rising above limitations was something that you felt proud of and that you did. What comes to mind?
Yeah, so I had been diagnosed when I was 26 years old, and it came out as a shock. I mean, it came out of nowhere. Up until that point, I was an avid hiker, backcountry kind of enthusiast, and I was diagnosed and hospitalized for about a week because they had misdiagnosed me as a type 2 diabetic first. And I spent a week in the hospital, and then I spent a year doing shots instead of on a pump. And I had a really tough transition, kind of one, accepting my diagnosis, but then also really starting to learn how to take care of myself. And after a year and a half, I ended up getting on my first pump. I was on a T-Slim pump and decided that I wanted to get back into what I found to be very healthy, growing up, which was the hiking. And so my dad and I chose an adventure. We chose to do a hiking tour around Monte Rosa, which is in Italy. It borders Italy and Switzerland. And it's the highest, just outside of Mont Blanc, it's the highest you can summit in the Alps. And we did a 10-day journey around the mountain and then hiked up to over 15,000 feet. And for me, being able to kind of take that time to push myself and also understand that I could do things that I really enjoyed doing before my diagnosis, really helped me understand that this was something that not only I was going to live with, but it wasn't going to be something that was going to drag me down, but in fact could actually make me stronger. And it was a time that really made a difference I think, and changed the outlook that I had for the next, really for the rest of my life. And I've been, trying to find the next summit ever since.
What do you have? What do you have in mind? Anything on the horizon?
Yeah, so I've been to 49 states. I'm missing Alaska, and Alaska has also some of the highest mountain peaks, Denali in particular. Are some exciting hikes that I'm really looking forward to. But the other thing that I've never been on a solo hike. I've always been on hikes with others. And so
Mm.
one of the things that I'm really interested in doing, I travel alone all the time, but I don't go out backcountry camping by myself. And it's actually one of the goals that I have this year.
Well, I'm excited for you to do that. It definitely is. There's not, it's a different experience. There's not that safety net. I remember a couple of years ago, I went out to Joshua Tree in California and I was doing like a solo retreat. I think best when I'm just like in nature, in space I turn off technology, all of that. And I was like, all right, I'm going to go out for a hike. And I'm an hour into this hike and I'm looking around and there's not a soul to be found. There's not like you can't see any road, any highway, anything. And I look at my bag and I have like 2 glucose tablets left. And I was like, okay, that was like a wake up call for me of like, if you're going to do this, like you have to be a little bit more prepared. And I ended up being fine, but it was like, still, if something does go wrong, like you can be in a very just vulnerable position here. So for you, when you did that initial 10-day hike, it seems like that set the precedent for like, this is how I'm going to live my life with type 1 diabetes. What were, and I don't know if you remember, like the blood sugars, like did you have an easier time? Was it, since it was earlier on in your diagnosis, did you feel like it was challenging and you had lows or highs? Like what was that like?
Yeah, it was really challenging. I mean, I think a couple of things, and this is generally why I like hiking and backcountry camping so much, is generally my sugars are really low. And because you're getting so much regular exercise, I'm constantly trending low. But, generally after a big day of exercise, you tend to carb up at the end of the day. And particularly in like hiking and backcountry stuff in Europe, you can get some amazing, polenta or pasta after your hikes, and I would then trend up high. And so it was this kind of seesaw that I was seeing kind of back and forth. That was in 2012. So since then, I've been able to kind of fine tune the way it is that I go out and prepare and think about, kind of how I need to prepare for those ups and downs. But at that time, I was traditional, like I was just going low all of the time. And I wasn't quite prepared for it in the same way. But the hiking in Europe is very different than the US, which I'm happy to explain, but it is very different. And so there are more safety nets, I would say, in Europe than there are, if you're backcountry at Yellowstone or Glacier.
Can you expand on that? I'm curious to know what you mean.
Yeah, so traditionally in the U.S., we have a culture around backcountry camping where you bring everything with you: your tent, your stove, you've got food for X amount of days. In Europe, traditionally when people went from country to country and you would cross like the Alps, let's say, right, from southern Europe into northern Europe, they created hut systems where you could go hiking through the Alps, and at every night you could stop at a different hut where you'd have a simple bed and then they'd provide you some food or a beer, and then you'd make your way to the next hut. And so you can go through the entire Alps going hut to hut hiking, and you don't need to carry all of the same things that you would need. And in the cases for me, when I think about when am I going to be able to get the sugars I need? When am I going to be able to get the food that I need? I can put that into the planning, which you can't do if you're 5 days, in the middle of of nowhere without a way to kind of contact emergency help if you needed to.
Well, you also, when we were in person, you also were talking about the challenge of, and I'm going to butcher this so you can just clarify what I'm getting at. I think you'll know, but you were saying when you're hiking in the U.S. and you're backpacking, you can only bring so much food with you because of like the wrappers and things like that, like have to be thrown out a certain way. Is that like sparking anything
Yeah.
that needs to
Well,
be
there's
shared?
a yeah, absolutely. There's a couple of things. I mean, especially if you're going out for, multiple days, weight matters. How much you're carrying absolutely matters. And because it literally weighs on you. And, generally in our national parks, there's a policy, leave no trace, right? Where we don't want to be polluting our parks. And especially as type 1 diabetics, we have a lot of wrappers. We've got a lot of, just from the supplies that we're bringing. And so then, I've had to learn specific ways to pack the diabetes supplies, so that I'm bringing just less packaging, but I can still protect the integrity of the reservoirs, right, of the Dexcom sensors that I'm using. But then on top of that, then there's all of the food and everything, and you don't want to leave anything in the park, so you have to bring everything out with you. And so the weight really does matter, and how you pack really matters. And especially for type 1 diabetics, we need to be thoughtful of it just because we're carrying, so much of the life-saving stuff that keeps us going.
Right. And it's that whole thing of like, we're told when we're diagnosed, like, this isn't going to stop you from doing anything. And then it sounds really nice. And then you get into like kind of your world of like, okay, it's not going to stop me, but like this takes a lot of extra planning and thinking and layers in order to execute this confidently. Do you ever, curious, do you ever resent it? Like, do you ever resent or like people who can just hike and not have type 1 diabetes and not have to like think and plan as much? Or does that never really cross your mind?
I don't know that I resent it. I'm very mindful that it is something that I have to pay attention to that other people don't. One of the things that I started to do early on into my diagnosis was, I mean, I let everybody know, and especially on camping trips, I would kind of turn, like having people guess my blood sugars as we're hiking along. I'm like, I'm feeling low. What are the bets on where I'm at? And so I kind of turned it into a system that made me feel kind of excited about sharing, how I was feeling on these hikes with the people who I was out with. And I think it turned something that could have been more a negative into a positive. And so I don't resent it, but I am very aware that it is something that I have to pay much more attention to. I can't just even a shorter hike. I can't just get up and go, right? Like I should pay attention to what I'm bringing along. And I don't resent it, but I am very mindful that it's something heavier that weighs on me, emotionally more than anything else.
Yeah, absolutely. And I want to talk more about some of your goals for adventurous things and figuring out. I know we talked about a little bit of like I want to figure out how to do this and still, and maybe talk to people who have done it before, so we can get into that. But I want to backtrack on something you shared earlier, which was that you were misdiagnosed as type 2 at 26 years old. Can you tell me a little bit about that experience when you were diagnosed as type 2, how you felt in that moment versus then when you got the type 1 diagnosis, how you felt in that moment, and like were you why you think you were diagnosed as type 2?
Yeah, I at that point I was working, around the clock, 24/7, and um, I lost about 25 pounds in a month, and my eyesight started to go, extremely blurry, and I was going to the bathroom all of the time, and I didn't. I'm adopted, and so didn't have any of my family history. And so we didn't know to look to any of these signs. And as I actually went to get my eyes checked, and I was like, I need glasses, and they said, well, you should check your blood sugar because your eyesight's been great, for as long as we can see, and you should go get your blood sugars checked. And I was like, okay. Um, and at that time, my A1C was 14.2.
Oh,
I was like at 400 or 500, and they put me on metformin and kind of sent me home. And at the time, I was still kind of reeling with the fact that, trying to understand what type 2 diabetes was. We couldn't look into my family history. I didn't know who my birth family was at the time. And I would say generally I felt really scared. And after about 4 or 5 days on metformin and no change in how I was feeling, we called up my doctor who said, come into the hospital. Like, we've got to check this out. And, I spent the next 4 days then running a ton of tests, trying to figure out exactly what was going on, and realized that I was a type 1 diabetic. And I spent the next, week meeting with specialists to try and figure out, what it was going to mean for me specifically, and also intrigued me on like I should try and find my birth family to figure out if there's other surprises that are in store. But it emotionally, I think I was just kind of jarred. I was like, all of it kind of happened within a month and a half, and was not expecting the result that came out of it.
this episode is brought to you by Omnipod. Many people don't know this, which is why we've partnered with Omnipod to help spread the word. But did you know that if you're curious about trying the Omnipod 5 tubeless wearable system, you can do so with no commitment, no obligation, and even if your current pump is in warranty? Crazy, right? Omnipod truly wants to make it as easy as possible for you to test our new system out and see how great life can be with it. There are so many benefits, my two highlights being that the activity feature sets a temporary higher target for times where less insulin is needed, and it integrates with Dexcom G6 to automatically adjust insulin every 5 minutes. So if you want to get on a pump for the first time, or if you want to have more freedom without a tubed pump, you can see if you're eligible for a free trial by going to omnipod.com/rise. Fill out the quick form and they'll do the work to check insurance coverage for you. You can also view full safety information, instructions for use, and trial terms and conditions at omnipod.com/rise. Now, right back to the show. Any autoimmunity in the the tree there?
No, there's not. I just got lucky. I ended up when I turned 30. I looked for my birth family and found my birth family. They'd been living in Chicago. I have 10 brothers and sisters. At the time, I was working in a neighborhood in Chicago, and my birth mom lived about a mile and a half from me. And ended up, meeting her, and while it wasn't my first question, it was definitely, kind of top 10 of like, I'd love to know a little bit more about our family's medical history. And discovered that there was no one else who was either type 1 diabetic or shared. I was even looking at like kind of general chronic illnesses, and they didn't
Mm.
have them. So I got lucky. I do have a theory on how I might have kind of um, how I developed some of the symptoms, but I just got lucky.
You mentioned overworking a lot. You were in a very busy period of work. I know you work a ton. Is that what you're thinking of, just setting off like the stressors on your body, or something else?
I think the stressors might have been a catalyst, but I had been doing some backcountry camping, and I got really sick from some water that I think was uh, I had gotten an intestinal virus, and it had laid me out for about a week and a half. And after then, I didn't put it together, but I started experiencing lows and fatigue, but I didn't attribute it to being sick before. And I probably
Mm.
spent a couple of months kind of in and out of these different zones, and then I think the stress from work shortly thereafter, kind of later that season, coming back from that trip and having gotten sick, and then the stressors might have been the catalyst from getting sick from the water, I think, which gave me that
Wow.
intestinal virus. Yeah.
Wow, it's amazing. It's always interesting to hear like a virus, or like what everybody kind of can, in hindsight, tie it back to. And it was like, oh, that's in such close proximity to when I was diagnosed. Um, for you, after you received your type 1 diagnosis, in the past, let's say in the first 10 years of having it, I know you're on like around year 11 now, but first 10 years, like, what was your what were the challenges that you came up against? What was your healthcare support like? I just want to understand a little bit more about that, because everybody's is so different.
Yeah. I would say um, it felt, and I don't want to disparage like my endocrinologist when I was first diagnosed, but it felt very kind of matter of fact and cold. It was just like, here are the facts. Here's what you need to get on. At that time it was a T-Slim pump. And there was very little education around like what it was going to mean for my day to day, lifestyle. And there was kind of like, here's the training on how to use the pump, go with God. And it felt very cold. And I think we had a nurse practitioner who was probably, um, felt like the kind of angel on my shoulders as I was going through that, because she seemed a lot more kind of tuned in to the fact that I was trying to learn a lot of different things, not just the use of the pump, but really it was like, what is this going to mean for my day to day? And she shared resources that were really helpful. But looking back, I was like, it fell short from what I needed and what I think I'd hoped for. And since then, have learned to kind of demand certain things from the specialists around, like, I need more information, help me think about this. Um, uh, but honestly, Risley, I mean, for the shameless plug, right? I mean, I think the curriculum, the space that you all have created is something that should be part of, people's diagnosis, I mean, right away, because there's just so much to learn and so much to think about how it does affect us.
That's the vision, Jesse. That is the vision right there. So I hope one day we can like take that and then juxtapose or put it with like, in a couple of years, all the hospitals having, Risley coaches in them, because it really is necessary. So I know that your A1C kind of always ranged from about like a 7.1 to an 8.5. It was always fluctuating. Did you feel like when it was fluctuating that let me actually rephrase my question. When you look at that fluctuation over the years, do you feel like it was in that range because of a lack of motivation, education, or implementation? Like, where do you feel like the deficit really was that attributed to that A1C kind of fluctuating so much and being on the higher end?
I think I think it was more around reaction. I listened to one of your when my wife had shared, about Risley and it kind of turned me on to the work that you all were doing. I listened to one of your podcasts and I'm forgetting what episode it was, but there was something you mentioned about, just taking some time, before you eat that bar, whatever it is, right? Taking a moment for yourself and just thinking like, what is it that, how did this make me feel the last time that I had this bar? Did I give myself enough carbs? I think just like taking a step back, breathing for a second before we just immediately react. It's like, oh, I'm 250. I need to give myself some insulin. Before you like pump in the punch in those numbers right into your pump, I think it's just like taking a second to like understand how you got to this point, and starting to create this muscle memory around the things that take you to the place where you don't want to be, and how do you stay in that zone where you do feel much better and your energy levels are okay and you're not feeling tired, and I think for me I was a lot more reactive, and just kind of responding to things that were thrown at me every day in everyday life. And so being much more reactive instead of kind of reflective about, how I can really own, my diagnosis, and in particular, like really own. I think the Omnipod that I'm on now is, it's a part of me, right? Like I change the sites every day, but really, I think thinking about it as just it being a part of my body, I think is really important, and that reflection time versus being reactive is really important.
Right. Figuring out how to optimize it and work with it instead of it being like a separate entity from you. What's really interesting is you said that your wife sent you the podcast. Is that how you found out about us? Was it through her?
Yeah, I was in a conference in DC and had a really, I had what did I had an Aperol spritz and some Thai food and knocked out in my hotel room. And I share my readings with my wife, and she called my hotel room because I wasn't picking up my cell phone, and was like, "You're at 400. You need to give yourself some insulin." And I mean, I was just completely knocked out. And I came back from it, and she was like, "Look, this doesn't happen often, but the fact that it did is, we should take this
Right.
seriously and think about it." And I was like, you know, "Thank you for saying something and calling it out. You're absolutely right." And then I did nothing for a month, because then it was like back in the grind. And she found Risley. She had done some poking around and was like, "Hey, listen to this podcast." And I listened to the podcast, and then she was like, "What do you think about the coaching?" And I was like, I'm in. I like the sound of it. This is helpful.
Well, it's so interesting that, and I wanted to like really highlight that because we get so many emails and so many applications from partners of specifically like wives, I would say, of men who they're like almost like applying for them, or they're saying like, hey, like this is what's going on with my husband, like can you help him? And what we always say is we're like, we're so happy that you're there in his corner, but like this is a conversation, like you need to get him to the place of applying and asking for help, because that is like the absolute crucial foundational step that needs to happen for us to even be able to help. He has to acknowledge that like he needs the help, he wants the help, and he's open to receive it. So that Aperol spritz moment, man, that was the kickoff, that was the turning point.
That was a turning point.
So when you think about asking for help, I don't want to like go into gender too much, but I think it is important to have this conversation around this, because we haven't yet on the podcast had this conversation. But interested like in your experience as a male and your relationship to asking for help. Like what in 10 years of struggling with your numbers, how did you get to that place of asking for help, and was there shame around it? Like talk through that with me.
Yeah, I mean, I think generally asking for help is a hard thing to do. Um, uh, and I think definitely, I mean, just kind of speaking to being a Latino man, right? Like there are things that I carry that I know, prevent me sometimes from asking for the help that I need. And it's not just with diabetes. I mean, it's just like in life, there's things that come up, and I think, being humbled through the experience of kind of learning that especially like being a type 1 diabetic, that there are things that I've got to pay attention to, and I can do 100 things right in a day, and my numbers are still going to go high, right? Day to day, it looks a little different. Realizing that I don't have that perfect control humbles you in a way where, I had to realize in many different spaces that I needed help. And I also, after 10 years of my diagnosis and seeing that, as you mentioned, my A1C being, kind of bouncing around between 7.0 and, 8.5, right? It's like, something's got to give. And I may not like to admit it, but I'm doing something not right here. And I've got to think creatively about this. It also comes at a time where, I'm thinking about some of these adventurous hikes, right? Hiking Denali, going to some of these mountain peaks. Um, my As I'm getting older, right, it's harder and harder to recover from these things, and I think also realizing it's in my self interest to ask for help, because I don't want to stop hiking. I want to keep climbing mountains. I want to keep doing adventures. And if I want to keep doing that, then I need help. And so I think part of it was this realization around my own self interest and knowing that I didn't have all the answers, and there were people who do have the answers. And it's a hard thing to accept for sure, but definitely having a partner who is very thoughtful about that and understands my own interest in the hiking and like being a healthy person in general was really helpful. And she helped call me out, I think, which was also a helpful nudge for sure.
And it sounds like she did it in a way where she wasn't somebody who's like constantly nagging you and like she's on your Dexcom share. It sounds like, but it wasn't like constantly like you have to get this under control or what are you doing, or it was like that one time she saw an opportunity of like, hey, like this is scary, like I that made me feel not great, not being even in the same state as you, and you having that high blood sugar, and it could have been went sideways. So um it sounds like timing too was it was divine timing for that all to happen and for you to hear that.
Yeah, timing was really important. I also, even sharing my data was something that took me some getting used to, and just like thinking about, yeah, am I going to share my data with her? Because I mean, it is personal, but I also, in some ways, there's also like, I am flawed, and she's going to start seeing, right, that like I'm having that afternoon snack and it's peaking, and definitely like a willingness to realize that the sharing is caring.
Hmm. So once you now being on the other side of Risley coaching, you did one-on-one coaching with Coach Jihan. What was what did you initially think was going to be the solution and the thing that was going to get your A1C in a lower place versus what it actually was? And not just your A1C, but your numbers, your confidence, your understanding about your body. So even if you think about like 5 years ago when you were thinking in your head, like, all right, something has to give, I have to try doing this. What was the this? Like, what did you think the answer was versus what ultimately helped you reclaim your diabetes in relationship to yourself?
A lot of it was, data. It was like, I need to understand the data. I need to understand how each of these foods is going to make a difference. Am I doing the proper carb counting? It's not a piece of my diabetes that I'd like to pay that much attention to, but I see the value in paying attention to the data. And coming into the sessions, I think that was something that I really wanted to lean into, and identified as one of the areas that I really wanted to grow. And while it is still that, and there's still some growing that I need to do in that area, the thing that came out of the coaching really surprised me, which it wasn't the data, right? It was just generally a more holistic approach to the way in which I was like treating myself. And, I mentioned earlier, like being reflective and not reactive, ended up just being a game changer. And my A1C, just in the 3 months of coaching, right, stabilized. It's the first time my A1C has not fluctuated in such a way I've started, right? And some of it was looking at the data and like kind of thinking about it and looking at patterns, but most of it were like little lifestyle changes, just partially emotionally, mentally, the way that I was like approaching the my own diagnosis, and that for sure surprised me.
No, absolutely. We always say like people come from one thing and they get some of that, but they also get what the other thing of like what they actually need, right? There's things that you want and the things that you end up getting, and sometimes they're the same, sometimes they're a little bit different. But um, you mentioned, earlier when you had that experience with your doctor, it was a very cold experience. It was the nurse practitioner seemed like she was the one that was like more had better bedside manner, or whatever you want to call it. How would you describe the difference between working with a coach? I wouldn't call us providers, but a coach in your healthcare, somebody as an extension of your healthcare team that lives with type 1 diabetes, and how much value would you put on that quality of coaching?
I mean, there's a big difference, and um, some of it is just like a shared experience, which makes a world of difference, right? Just like understanding um, how different our days can look. Every day is going to be a little bit different, and having somebody who understands that and is thinking in the same way that you are about kind of problem solving around the day to day is extremely helpful. Um, and forgiving. I think I will say that I think one of the things that that felt particularly cold from my endocrinologist at the time was um, it felt almost like punitive when I came in with readings that were high. It felt like there was like I was being kind of, I don't know if chastised, but I felt like I was constantly in trouble versus having somebody who kind of understands the cadence, the highs and the lows, and like what that looks like day to day, and is thoughtful about the solutions that we're collaboratively thinking about that prevents those highs, and understanding that those highs, we're not trying to go up that high, but it's okay if it happens, and how do we figure out how to problem solve instead of like, if you keep getting highs, you're going to die early, right? I mean, it's like that's not what was said to me, but that's what it felt like. And I think that aside from that compassion, the awareness around what the day to day looks like starts to create all of these new solutions that I'd never heard of before. Instead of being kind of so here's what the pump does and here's what you need to do.
Right. More focused on you as the human being versus on the separate parts of you with just food in isolation over here and then the pump in isolation over here. No, I think that's really well said. And I wanted to bring that up because I do think that like the lived experience of having type 1 allows for more of just like a non-judgmental space for you to feel free to say, come on and say, yeah, like I had a really, hard past couple of days, and knowing that that's a safe space for you not to be judged. But it's like, okay, great. Like, let's see what happened here. Let's dig in and let's pull it back without judgment. Um, one of my thoughts for you, and I'm interested to hear how you answer this, but you're at this place now where you've made so much growth and so much stride in getting to a place where you understand your body more. You feel like your numbers, what I'm hearing, are more predictable. Like there's not going to be a surprise when you go in to get your next A1C. You're not going to be like, oh, how the heck did it go back up to 8.5, right? You're like, oh no, like I know what I'm doing and like what kind of results I'm going to get by the next A1C. What is like your next stage of growth? Because it's never finished. Like where are you looking to continue to grow in like, let's say going into 2024?
Yeah, I think I mentioned the data piece. I think for me there is a growth edge, in particular around like um, understanding how I can use the patterns that emerge out of the data from what I'm doing in the morning, what my meal looks like to the evening meal, and really using that to understand better how I can level off as much as possible instead of having those peaks and valleys. And so one is I think really paying attention to the data, and I think within that is like learning the systems that allow me to be better about tracking the data, right? So like writing the notes, I think one of the things that that was introduced early was the journal, right? Journaling. I'm a horrible journaler. I have a hard time sitting down and doing it. And so for me, I need to be creative about what that looks like. And it's not going to be sitting down and doing the journaling. So, how else can I capture that data? And like, what is it that I've eaten that then, the blood sugar before and after. I need to figure it out, and I don't have that yet. And so for me, that's a really big growth edge, something that I'm going to pay a lot of attention to. And I think something that was really helpful, kind of coming out of the sessions. Was habit stacking, figuring out different ways in which I can build into my regular, like everyday patterns, my everyday life to be able to capture the data that I want to capture so that it doesn't become this huge monumental task and project, but rather something natural into my routine, my daily routine.
Right. And what comes to mind here is that happiness is when we have perceived control, right? And so it's almost like you have this perceived control and you do it almost even like have not the control, maybe that's the wrong word, but you have all the pieces. Now after going through coaching, you're like, I have all the tool sets. I know what works, I know what doesn't work. Now it's more so just systemizing it all and continuing to double down on it. And there's not a question of like what else could I be doing? It's more so how can I just be more efficient with the things that I know and I've learned about myself that I need to do. Is that accurate?
Yeah, I think that's spot on.
That's spot on. Yeah. So I was teeing you up a little bit for this, and I want to end with this, but you didn't. I'll call it out. Scuba diving. That's what you had said
Yes.
too. Was like a next phase. You were like, I want
Yes.
to learn how to scuba dive with type 1 diabetes. Have you done any kind of like research on it? We were talking in Chicago about it, and yeah, I just want to know where you're at with that goal.
Yes, I'm so excited, and it was so helpful to hear from your guest that he just has done it and is like, you can figure it out. So yes, it is a goal this year. I didn't mention it just because I was thinking about all the hiking and camping that I'm excited about, but absolutely the scuba diving is on the list. The first step is to get certified, and am going to. What I'm trying to figure out is like what are the things that I'm going to bring with me on a boat, that I know I can kind of get up quickly for. And as I've been doing more research, right, like obviously the depths that you go to really kind of make a difference. And I'm totally able to kind of go to 10, 20 feet, and know that I can get back up relatively quickly if I'm having a low dip. But I won't know until I try, and so that's one of the things that I'm really going to lean into is going for it this year. And really, it was listening to that other guest that I think in a lot of ways I was overthinking it. In a lot of ways, I was like kind of putting myself in a space that I didn't really need to be in terms of like all of the worst case scenarios, which I'm not prone to doing, but I was definitely
Right.
overthinking it, and I think you just got to take that leap.
Yeah. And so for everybody listening, the episode that Jesse is talking about, it was an episode that I did with Ollie Roland. I'm trying to scroll right now and look at what number it was on the podcast. But if you scroll back, you can find it. And he was a stuntman for like all of the Marvel movies, and he now works on like Dolly Parton's team. But he drove like a motorcycle into the Arctic Circle, and it's just I was like when I heard him, I was like, oh, like you and Jesse, like Jesse needs to listen to this. I gave it to Jihan to send to you. I can't find the number right now, but if it was sometime earlier this year, so you guys can scroll back and find it. But yeah, like and it's a great point, Jesse. It's like sometimes we overcomplicate things in our head because of fear, right? Like we think up all these scenarios of what could go wrong, and like Ollie, I was so surprised to hear. I think he was on multiple daily injections when he was just like, "Yep, I just gave myself the injection. I dive in, I'm good," and it was just like as simple as that. And so he's obviously less prone to, it sounds like, fear or isn't very risk adverse. So, depending on your personality, like you are somebody who needs to prep more, and I think is, advantageous for you to do and for anybody to do. But all to say, we're excited to hear when you do get your scuba diving license and certification because we want to see you breaking limits.
Yes, I'll send lots of pictures.
Please, please do. So, Jesse, please, the last thing I want you to share and I want you to leave us with is the talk about the guide that you are working on and share a little bit about that.
Yeah. So, I've been on some great adventures, and I've learned a lot about what it takes to be able to take some of these trips that might be a little daunting for type 1 diabetics. And one of the biggest frustrations has been just how little information is out there for type 1 diabetics who do want to take some of these different trips. And just as an example, I went dog sledding in the Boundary Waters in Minnesota last winter, and it's like, what do you do with your insulin, because you can't have it freeze? And in sub-zero temperatures, how do you take care of your insulin? And what do you do with your supplies? We know that our glucometers and our pumps, if it gets too cold, do freeze up, right? And we'll tell you that they need some time to warm up. And so those aren't things that are really kind of explained to us unless you're going through it. And so I've started working on a guide, which was like one of the things that actually kind of came out of the coaching was I'd like to put together a guide, and have already got some really good pieces in it that help people think about, one, the like trip planning, the prep work that needs to go into it, but then a lot of the things that come up on these trips that people should be mindful of. So not just in the planning and preparation, but what are some of those tips and tricks that you can use throughout the trip, that allow you to take care of your supplies, and take care of yourself as you're taking on these different adventures.
Yeah, it's going to be such an incredible tool for people who are listening to Jesse's story and saying like, oh, like I want to do that. Where do I start? So we are going to help distribute that when it is ready. For everybody listening, coaching alumni will be circulating it around the alumni, just Slack channel that we have, and putting in your portals. But then for everybody else listening, make sure you're on the email list. So if you go to the Risely website, riselyhealth.com, and just sign up for our email list, there is where we'll distribute it when it is out there. So Jesse, I'm like putting that down so that you can be motivated to like finish it and we can get it out to the
Absolutely.
world.
Absolutely. Yes.
Incredible.
Looking forward to it.
All right, Jesse, thank you so much for sharing your experience, your rise, and just all of you with us today. We really appreciate you being here. I really enjoyed this conversation, and just looking forward to what you do next.
Me too, and thank you so much to you and your team who have been just so helpful, and I really can't speak enough about how much I think that the coaching is a game changer for those of us who are really looking to kind of figure out how to evolve and grow, through our diagnoses. So thank you.
Thank you, Jesse. It's been an honor to be part of your journey and to continue to be part of it. I'll see you guys later. Bye, Jesse. Thank you so much for being here with me today and listening to this episode of Reclaim Your Rise. To let us know that the episodes we're putting out are impactful and to help us get our street cred up and let everyone else know that this is something worthy of their time to listen to, please leave a rating and review on our Apple Podcast, send the show to other people impacted by T1D or maybe even your doctor, and share it on social media tagging at Risely Health and at Lauren_Bongiorno. New episodes of Reclaim Your Rise come out every single Tuesday, so make sure you are subscribed to the podcast so that you never miss a beat. Thanks again for listening, and as always, remember, diabetes is a challenge that we did not choose, but one that we can rise above.